Hello students, myself Jamika Patel, and today we are going to revise the topic psychiatry nurse quality. What are the qualities of a psychiatric nurse? So let's start. First we will see what do you mean by qualities. So your personality and the way you communicate with people, that shows, and how you manage your skills in crucial times in psychiatric field, that shows your qualities, that shows your personality, right? So you have to be always warm and engaging in empathy, showing services individual when any individual is facing any problem, right? You are able to manage those situations. So all these things shows the quality of a nurse. And when you are especially in a field of psychiatry where you are handling a patient, abnormal behavior, so you have a few different qualities. So let's start with introduction. So a psychiatric mental health registered nurse is a nurse who is specialized in the care of individuals with mental health or psychiatric issues. As I told you earlier, a psychiatric nurse most commonly provides evidence-based nursing care to deliver advanced mental health care to people in a variety of environments and units. More than many other nursing specializations, the psychiatric nurse is responsible for talking and listening to the individuals. The psychiatric nurse works closely with psychologists and psychiatrists, healthcare providers and physicians who specialize in the care of individuals who need mental health interventions. So this was about introduction. Now, what are the principles of mental health nursing? I'm just briefing the principle, like what qualities also, it shows what qualities a nurse should have in psychiatry. So, accept the patient as human being or exactly as he is. Use self-understanding as a therapeutic tool. These are few basic principles I'm going to tell you. Use consistent behavior to increase the patient's emotional security, or reassurance should be given when in acceptable manner, right? Avoid unnecessary increase increase anxiety in the patients. So these are few principles which we need to follow. Next, we are going to see the function of psychiatry nurse. What work a psychiatric nurse do? So, the psychiatric mental health nurse role is designed to provide advanced nursing care and interventions that improve patients' outcomes for psychiatric patients in many different environments, depending on stage-specific scope of practice. A psychiatric nurse will do some or all the following work. Like, first one is take mental health histories from individuals and families, then review physical exams to ensure that physical problems do not exist that might explain mental health issues or that might interfere with psychiatric interventions. Then analyze and monitor results of tests, blood test, CT scan, MRI, mental status examination. There are different kind of tests, neurological examination. So they analyze and monitor the result of test. Evaluate mental health problems and formulate nursing diagnosis based on history, exam and testing. Yes, according to the patient situations, according to the patient problem, a nursing diagnosis we formulate to give care. Create plan of care for patients and families based on the patient problems and nursing diagnosis. So according to our nursing diagnosis, we plan the care for the patient and family members. Then administer and monitor medications and treatment based on the plan of care. Whatever medications we have planned or whatever treatment we need to give, that we need to plan. Then evaluate the patient's and client's response to prescribed medication and treatment. Teach and collaborate with patients and families about the findings and plans of care. And collaborate with and educate other members of the healthcare team. We need to collaborate with other healthcare members to better treatment of the patient. Next we are going to see the qualities of psychiatric nurse. So certain attitudes and are necessary for psychiatric nurse to deal with psychiatric patients, right? The first one is self-awareness. So a psychiatric nurse should have a realistic self-concept and should be able to recognize her own feelings, fantasies and fears. She should analyze her own professional strengths and limitations. Her ability to be aware and to accept her own strengths and limitations should help her see the strengths and limitations in other people. So if we know our strengths and limitations, definitely we can make judgments about other people as well. Next one is self-acceptance. The nurse should not only be aware but also accept her strengths as well as her limitations. Self-understanding helps her to be assertive in life situations without being aggressive and feeling guilt. Like whatever our limitations are, we need to accept them and we need to be assertive in a situation, or we need to assertive in a positive way, so that we can control our aggressive behavior towards the situation. Then, accepting the patient. So, as I told you earlier in principles of psychiatric nurse, we need to accept the patient as he is without being non-judgmental. Acceptance conveys the feeling of being loved and care. When you accept someone, right, you love them, you care for them. The nurse should accept the patient as he is, as a sick person regardless of caste, color, race and behavior. Yes, we need to take care of the person. We need to take care of the person without any racism, without any caste, color, race, behavior. Fourth one is being sincerely interested in patient care. This is very much important. Being sincerely interested in patient care means considering the patient interest. It's not that like we are telling them you need to do this. We are not making them to do forcefully. It's just that we need to convince them. We need to see the patient's interest. What kind of work a patient like to do. So according to patient interest, we need to work with them. Being available. Being available means a nurse should be approachable all the time to the patient. She should convey to the patient that she is available not only to meet his physical needs but also assist him in dealing with psychological needs. Being available means whenever patients need a psychological support, whenever he is in stress or whenever he is having an anxiety or whenever he is feeling low. So by the time a nurse should be available to counsel him, to guide him, to tell what is right, what is wrong. So being available is very necessary to provide a psychological support. Empathizing with patient. Empathy is an important tool in understanding others' feeling. Empathy is a process when a person gets into another person's situation and experience what the other person feels and then is able to step back and analyze the situation. The nurse need not necessarily have to experience, but has to be able to imagine the feeling associated with the experience. We need to empathizing with the patient and we need to convince them that we understand your situation and everything will be fine soon. Next one is reliability. The nurse must demonstrate honesty, truthfulness, resourcefulness, and competence in her dealing with the patients and their families. She must prove herself to be trustworthy and as a person who can be relied upon in any situation. Next one is professionalism. Developing the professional skills of a psychiatric nurse is dependent upon learning as much as possible about the patient, his illness, and the helping role of the nurse as it specifically applies to the patient. Accountability. According to Papleau in 1980, the need for personal accountability and professional integrity are greater in psychiatric practice than in any other type of healthcare. Patients in mental health settings are usually more vulnerable and defenseless than patients in other healthcare settings, particularly because their conditions hinder their thinking process and their relationship with others. Mental health nurses are accountable for the nature of the effort they make on behalf of patients and answerable to patients for the quality of their efforts. It means whatever nurse is doing for the patient, she is accountable for them. She is responsible for patient total care, whatever she is providing to the patient. Tenth one is the ability to think critically. So the ability to think critically is crucial for mental health nurse. A critical thinker analyzes information before drawing conclusion about it, and it is a purposeful, reasonable, reflective thinking that derives problem solving and decision making and aims to make judgment based on the evidence. Ability to think critically. When we are thinking critically, we need some proof. We need some evidence to prove our point, right? So whenever we think critically, we need to come to the conclusion, and without any purpose, without any reason, we cannot think critically. We need to have problem solving and decision making qualities in us. Then only we will be able to think critically. Next one is genuineness. So genuineness is also a quality nurse should have. Means that the nurse should have an open, honest, sincere person who is actively involved in the relationship. Genuineness means that the nurse response is sincere, that the nurse is not thinking and feeling one thing and saying something different. So that is called genuineness. The next one is respect. So also called non-possessive warmth and unconditional positive regards. The patient is regarded as a person of worth and is respected as such. So we need to give respect. And concreteness, so involving using specific terminology rather than abstractions when discussing with the patient's feeling, experience, and behavior. We need to avoid vagueness and ambiguity, and is the opposite of everything generalizing, labeling, and making assumptions about patients' experience. So this was all about patients, what qualities a nurse should have. So self-awareness, self-acceptance, accepting the patient as he or she is, then being sincerely in the patient, being available, empathizing with the patient, then reliability, professionalism, accountability, to think critically, then genuineness, respect, and concreteness. So, two qualities which a psychiatric should have. So this was all about the qualities of psychiatric nurse. Hope you all understand. Thank you.